We're delivering a beautiful set of zirconia teeth today for a patient who's been through a lot. She actually had this procedure done close to 10 years ago. She broke her jaw in an accident, and that threw off her bite. And those are challenging situations because you essentially have to recreate her bite and figure out what implants were placed 10 years ago. And she happened to have 3 or 4 different implant brands in her mouth. So let me show you. So here's her 3D x-ray. You guys can see right there, those plates are where her jaw was repaired. And these are all the implants that she had. And these are, like I said, 3 or 4 different brands of implants, which makes it challenging because we have to figure out what implants they are, what the brands are. And then we have to recreate her bite, which is very challenging in this situation because if you look at her old teeth, you can see how flat her old denture acrylic teeth are. It's almost like a tabletop, super flat. And oftentimes it can be a challenge for patients to go from chewing on flat teeth to then chewing on teeth with sort of cusps on them. So our team spent a lot of time designing and redesigning her teeth to make sure she was happy, she wasn't biting her tongue, she wasn't biting her cheeks. And that can take some time, especially for patients that, number one, have a broken jaw, and number two, are coming from a 10-year-old set of teeth that are super flat. And now with modern technology, we can actually use digital software to plan and design the teeth and the smile that looks like this. And although this is a super challenging case with the broken jaw and fixing her bite and the 4 different implant systems and the flat teeth and the tongue biting and the cheek biting, those are the most rewarding cases because as hard as they are, there is a solution. You just have to spend the time and get it right for the patients that trust us. And that's what it's about. So hopefully that was a cool and educational thing for you guys. And any questions, let me know.